Hello friends, welcome all of you. Today we are going to learn about the nursing care plan on Angina Pectoris. This is a coronary artery disease. Here we learn how to make different nursing diagnosis of this disease. This is very important nursing care plan for students that's come in university examination, and also this is useful for प्रैक्टिकल फाइल वर्क। तो आइए देखते हैं एनसीपी ऑन एंजाइना पेक्टोरिस या एनसीपी ऑन कोरोनरी आर्टरी डिजीज। नर्सिंग केयर प्लान ऑन एंजाइना पेक्टोरिस हियर कोरोनरी आर्टरी डिजीज सीएडी, जिसको हम सीएडी के नाम से जानते हैं। सबसे पहले इसको देखते हैं, इसका इंट्रोडक्शन। सीएडी इज ए कंडीशन इन विच प्लेक बिल्ड अप इनसाइड द कोरोनरी आर्टरी। मीन्स सीएडी एक डिजीज कंडीशन है जिसके अंदर फैटी प्लेक हमारे कोरोनरी आर्टरी के अंदर जम जाते हैं। कोरोनरी आर्टरी आर आर्टरीज दैट सप्लाई द हार्ट मसल्स विद ऑक्सीजन रिच ब्लड। कोरोनरी आर्टरीज वो आर्टरीज होती हैं जो हार्ट में हार्ट मसल को ऑक्सीजन रिच ब्लड का सप्लाई करती है। द हेयर अदर नेम फॉर कोरोनरी आर्टरी डिजीज आर एथेरोस्क्लेरोसिस, मीन्स डिपोजिशन ऑफ द फैटी प्लेक, या कोरोनरी हार्ट डिजीज या हार्डनिंग ऑफ द आर्टरीज, हार्ट डिजीज, इस्चेमिक हार्ट डिजीज, नैरोइंग ऑफ द आर्टरीज। कोरोनरी आर्टरी डिजीज को हम कुछ नामों से जानते हैं, जैसे एथेरोस्क्लेरोसिस या कोरोनरी हार्ट डिजीज, हार्डनिंग ऑफ द आर्टरीज, हार्ट डिजीज, इस्चेमिक हार्ट डिजीज एंड नैरोइंग ऑफ आर्टरीज। तो यदि इनमें से किसी का भी आपको नर्सिंग केयर प्लान आए, जैसे कि मेक ए नर्सिंग केयर प्लान ऑन इस्चेमिक हार्ट डिजीज, तो आपको भी ये सेम एंजाइना वाला नर्सिंग केयर प्लान बनाना है। तो दिस इज सेम एज एंजाइना एयर सीएडी। नेक्स्ट देखते हैं, कंटिन्यू एयर। प्लेक इज मेड अप ऑफ फैट, कोलेस्ट्रॉल, कैल्शियम एंड अदर सब्सटेंसेज फाउंड इन द ब्लड। प्लेक होता है जो कोलेस्ट्रॉल, फैट, कैल्शियम और अन्य सब्सटेंस से बना होता है। प्लेक नैरो द आर्टरीज एंड रिड्यूस ब्लड फ्लो एयर, reduce blood flow to heart muscles. Next, it also make it more likely that blood clot will form in arteries. Blood clot can partially or completely block arteries. मीन्स प्लेग के साथ साथ यहाँ ब्लड क्लॉट का फॉर्मेशन भी हो सकता है जो आर्टरीज को पार्शियली ब्लॉक करेंगे या कम्प्लीटली ब्लॉक कर सकते हैं। नेक्स्ट, व्हेन द कोरोनरी आर्टरी आर नैरोड और ब्लॉक, जब कोरोनरी आर्टरी या तो सक्रिय हो जाएगी या ब्लॉक्ड हो जाएगी तो जो ऑक्सीजन की सप्लाई है वो हार्ट मसल में नहीं पहुंचेगा। यार, व्हेन कोरोनरी आर्टरीज आर नैरोड और ब्लॉक, ऑक्सीजन रिच ब्लड कैन नॉट रीच द हार्ट मसल, दिस कैन कॉज एंजाइना और हार्ट अटैक। मीन्स जब ऑक्सीजन रिच ब्लड हार्ट मसल तक नहीं पहुंचता है तो उस कंडीशंस में एंजाइना या हार्ट अटैक कॉज होता है। विदाउट क्विक ट्रीटमेंट ए हार्ट अटैक कैन लीड टू सीरियस प्रॉब्लम एंड इवन डेथ। यदि हमने सही समय पर उपचार नहीं किया तो ये डेथ का कॉज हो सकता है। नेक्स्ट, द क्लासिकल सिम्टम्स ऑफ कोरोनरी आर्टरी डिजीज ईयर इज एंजाइना। कोरोनरी आर्टरी डिजीज का जो क्लासिकल सिम्टम्स है वो एंजाइना के नाम से जाना जाता है। ईयर एंजाइना मीन्स पेन कॉज्ड बाय द लॉस ऑफ oxygen and nutrient to the myocardial tissue because of inadequate coronary blood flow. Means angina is the classical symptoms of coronary artery disease in which pain caused by the loss of oxygen and nutrient to the myocardial tissue. Means angina वो कंडीशन है जिसके अंदर मायोकार्डियल टिश्यू तक ठीक ढंग से ऑक्सीजन और न्यूट्रिएंट्स नहीं पहुंच पाते, जो इसकी इनएडिक्वेट कोरोनरी ब्लड फ्लो के कारण होता है। मीन्स कोरोनरी आर्टरीज में फैटी प्लेक का जमना, जिसको एथेरोस्क्लेरोसिस कहते हैं, या क्लॉट जो कोरोनरी आर्टरीज को पार्शियली और कंप्लीट रोकता है, जिसके कारण ब्लड सप्लाई रुक जाती है और दिस कॉज एंजाइना। तो फ्रेंड्स, ये था कोरोनरी आर्टरी डिजीज एंड एंजाइना का कुछ इंट्रोडक्शन। तो ये हमको यहाँ समझना बहुत ज़रूरी है। तो नेक्स्ट देखते हैं नर्सिंग केयर प्लान ऑन एंजाइना पेक्टोरिस और CAD या कोरोनरी आर्टरी डिजीज सेम। तो सबसे पहले नर्सिंग प्रोसेस का हम फर्स्ट स्टेप लिखते हैं जो नर्सिंग असेसमेंट के रूप में, जैसे कि आप सभी जानते हो। तो यहाँ भी देखते हैं हम नर्सिंग असेसमेंट ऑफ एंजाइना इन assessing the patient with angina. Here the nurse may ask regarding the following, means while assessing angina patient, nurse ask the patient about the location of pain here, characteristics of pain, health history, pain scale, onset of pain, causes of pain. Next, defining characteristics after the assessment. Here same sign and symptoms like patient reports of pain varying in frequency, duration, and intensity, especially as worsen. Here, next second, distraction behavior, mourning, crying, pacing, restlessness. Next, autonomic responses like diaphoresis, blood pressure and pulse rate change, pupillary dilation, increase, decrease, respiratory rate. These are the sign and symptoms or defining characteristics that are assessed by while nursing assessment process. Next देखते हैं यार, on the basis of nursing assessment data, the most appropriate nursing diagnosis for the patient with angina pectoris. Here nursing diagnosis first. Here acute pain may be related to decreased myocardial blood flow and increased cardiac workload or oxygen consumption. This is our first nursing diagnosis in nursing care plan on angina. Here desired outcomes and goals for this diagnosis. Client will demonstrate relief of pain as evidenced by stable vital sign, absence of muscle tension, and restlessness. This is our goal for this diagnosis. Next देखते हैं intervention for this diagnosis and their rationals. Here means specific reason for this intervention. Here number first intervention is instruct patient to notify nurse immediately when chest pain occur. Here rational is unbearable pain may cause vasovagal response, decrease BP and heart rate. Next second intervention here assess and document patient response to medication. Here rational is aid in evaluating effectiveness of the interventions and may indicate need for change in therapeutic regimen. Next diagnosis intervention number third identify precipitating events if any, frequency, duration, intensity and location of pain. Irrational is helps differentiate this chest pain. Next observe for associated symptoms dyspnea, nausea, vomiting. Here decrease cardiac output which may occur during ischemic myocardial. Next number fifth next continue here dizziness, palpitation, desire to micturition. Here same continue means observe associate symptoms means dyspnea, nausea and vomiting, dizziness, palpitation, desire to micturition. Irrational here decreased cardiac output which may occur during ischemic myocardial episode, stimulate symptomatic and parasympathetic nervous system causing a variety of vague sensation. Next number fifth intervention evaluate report of pain in jaw, neck, shoulder, arm or hand, typically or left side. Here rational is cardiac pain may radiate, pain is often referred to the most superficial side. Number 6 here Intervention number 6, place patient at complete rest during anginal episode. Rationalize reduce myocardial oxygen demand to minimize risk of tissue injury. Next, intervention number 7, elevate head of the bed if patient is short breath. Rational facilitate gas exchange to decrease hypoxia and resultant shortness of breath. Next, number 8, intervention. Monitor heart rate and rhythm. Rational is patient with unstable angina have an increased risk of acute life-threatening dysrhythmia which occur in response to ischemic changes and stress. And next, intervention number 9, monitor vital signs every 5 minutes during initial attack. Rationalize blood pressure may initially rise then fall if cardiac output is compromised. Tachycardia also develop. Next, number 10, intervention. Stay with the patient who is experiencing pain or appear anxious. Here, rational is presence of nurse can reduce feeling of fear and helplessness. नेक्स्ट देखते हैं नंबर 11, intervention. Maintain quiet comfortable environment, restrict visitors as necessary. Irrational is mental emotional stress increases myocardial workload, so we restrict the visitors. Next, provide light meal, have patient rest for 1 hour after meal. Irrational is decrease myocardial workload associated with work of digestion. This is specific for this. Next, 13, intervention. Air provide supplemental oxygen as indicated. Air rational is increases oxygen available for myocardial uptake and reversible of ischemia, means lack of supply. Next, administer anti-anginal medications promptly as indicated. They are nitroglycerin, glycerin, sublingual nitrostate, buccal or oral tablet, meter dose spray. Nitroglycerin. Irrational is nitroglycerin for treating and preventing anginal pain. Your next medication, sublingual isosorbide dinitrate isordil. Here rational is rapid vasodilator effect last 10 to 13 minutes. This is for vasodilation. Next, beta blockers, acebutolol, sectral and atenolol, tenormin. This is beta blockers drugs. Next, these rational is reduce angina by reducing the heart workload. Next, medication, calcium channel blocker, Bipridil, Pascor, amlodipine, nor Pasc, nifedipine, procardia, produce relaxation of coronary vascular smooth muscle, dilate coronary arteries, decreases peripheral vascular resistance. Next, analgesics, acetaminophen, trinolone. Rational is analgesia for relief of headache caused by dilation of cerebral vessels in response to nitrate. Next, morphine sulfate here. Next medication. Potent narcotic analgesics may be used in acute onset because of its several beneficial effects, cause peripheral vasodilation and reduce myocardial workload, has sedative effect to produce relaxation. Next, monitor serial ECG changes here. Ischemia during anginal attack may cause transient ST segment depression or elevation and T waves. So we monitor ECG regularly for to check ischemic anginal attack. Here, after providing these interventions, we check the evaluation for this care plan. Here, now patient is relieved and relieve pain and client feel comfort. Means here our goal is achieved by this check we evaluation. तो ये था फर्स्ट हमारा नर्सिंग डायग्नोसिस. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस नंबर सेकंड फॉर एंजाइना. Here, second nursing diagnosis: a deficient knowledge, absence or deficiency of cognitive information related to a specific topic, inaccurate misinterpretations of information. Means patient have deficient knowledge about the angina, myocardial ischemia, atherosclerosis, fatty plaque, fatty diet also. Here, desired outcome and goals for this year: client will participate in learning process, verbalize understanding of condition, disease process and potential complications. Next, verbalize understanding or participate in therapeutic regimen, initiate necessary lifestyle changes here. Next, intervention for this diagnosis here. First intervention is discussed pathophysiology of condition, stress need for preventing and managing anginal attack. Here, rational for this patient will with angina need to learn why it occur and what they can do to control it. Next, intervention number second: review significance of cholesterol level and differentiate between LDL and SDL. Means low density lipoprotein and high density lipoprotein factors. Here, rationale for this emphasizes importance of periodic laboratory measurement. Next, number third intervention: encourage avoidance of situations that may precipitate anginal episode. Means stress, intense physical exertion, large heavy meals, especially during bedtime, exposure to extreme temperature. Here, rational doing so would reduce the incidence or severity of ischemic episode. Next, intervention number four: assist patient to identify source of physical and emotional stress and discuss ways that they can be avoided. Here, rational for this is crucial step in preventing anginal attack. Next, here number fifth intervention: review importance of weight control, cessation of smoking, dietary changes and exercise. These are the risk factor for this disease process. Rational is no knowledge of the significance of risk factors provides patient with opportunity to make needed changes. Next, number intervention six: discuss impact of illness on desired lifestyle and activities, including work, driving, sexual activity, hobbies. Provide information, privacy, or consultation as indicated here. Rational is patient may be reluctant to resume usual activities because of fear, anginal attack, or death. Next, number seven intervention: discuss step to take when anginal attack occur, cessation of activity, keep rescue nitroglycerin on hand, administer of PRN, means when required medication, use of relaxation techniques, means is the emergency management of this. Means rational for this year being prepared for an event takes away the fear that patient will not know what to do if attack occur. Next intervention: review prescribed medication for prevention of the anginal attack. Next, lipid lowering agents, while acid sequestrants, cholestyramine, quistine, cholestypol, cholestid. Here, these drugs are considered first-line agent for lowering serum cholesterol level. Next, medication antiplatelet agents as indicated here. Rational may be given prophylactically on a daily basis to decrease platelet aggregation and improve coronary circulation. Next, review symptoms to be reported to physician, increase in frequency of attack, changes in response to medication. Here, rational for this knowledge of expectations can avoid undue concern for significant reasons or delay in treatment of important symptoms. Next intervention: discuss importance of follow-up appointments here. Angina is a symptom of progressive coronary artery disease that should be monitored and may require occasional adjustment of treatment regimen. Here, after providing these interventions to patient, now we evaluate for this interventions, their effectiveness, and to know the our goal is achieved or not by this evaluation process. Now client's knowledge level improved. तो ये था नेक्स्ट नंबर सेकंड नर्सिंग डायग्नोसिस. नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस नंबर थर्ड. Here nursing diagnosis number third, anxiety may be related to situational crisis. This is third diagnosis here. Here desired outcome. Here client will verbalize awareness of feeling of anxiety and healthy ways to deal with them, and report anxiety is reduced to a manageable level. This is third nursing diagnosis goal or expected outcomes here. We plan the different interventions for this patient. Here first intervention, explain purpose of test and procedure. Here rationale is reduce anxiety attribute to fear of unknown diagnosis and prognosis. Next, number second intervention, promote expression of feelings and fear. Here rationale is verbalization of concern, reduce tension, verifies level of coping, and facilitate dealing with feelings. Next, intervention here, encourage family and friends to treat patient as before. Here rationale is reassure patient that that role in the family and business has not been altered. Next, tell patient the medication regimen has been designed to limit future attack and increase cardiac stability. Here rationale is number 4 rational, encourage patient to test symptoms control to increase confidence in medical program and to integrate abilities into perception or self. Next, intervention, administer sedatives, tranquilizers as indicated. Irrational may be desired to help patient relax until physically able to re-establish adequate coping strategies. Here, after providing these interventions to patient, we check the last step of nursing process. Here, nursing evaluation. Now, anxiety is reduced and patient feel comfort. नेक्स्ट देखते हैं नंबर नर्सिंग डायग्नोसिस फोर्थ फॉर दिस केयर प्लान. एयर nursing diagnosis number 4, decrease cardiac output related to myocardial ischemia, alteration in rate, rhythm, and electrical conduction. Here our goal and expected outcomes. Here client will report display decreased episode of dyspnea, angina, and dysrhythmia demonstrate decreased activity tolerance. For this achievement of this goal or desired outcome, we plan here the nursing interventions for this diagnosis. Your first intervention, maintain bed or chair rest in position of comfort during acute episode. Irrational decreases oxygen demand, therefore reducing myocardial workload and risk of decompensation. Next, second intervention देखते हैं. Monitor vital signs and cardiac rhythm. Here rationale is tachycardia may be present because of the pain, anxiety, and hypoxemia, and reduce cardiac output. Next, intervention number third, auscultate breath sound and heart sound, listen for murmur. Rationalize development of the murmur may reveals a valvular cause for chest pain, aortic stenosis, mitral stenosis, or a papillary muscle rupture. Next, here intervention number 4, provide for adequate rest period, perform self activities as indicated. Here rationale is conserve energy, reduce cardiac workload. Next, fifth intervention, here encourage immediate reporting of pain Prompt administration of medication as indicated here. Rationale is timely interventions can reduce oxygen consumption and myocardial workload and may minimize cardiac complication. Next intervention. Number 6. Assess for sign and symptom of heart failure. Here, rational. Number 6. Disease may compromise cardiac function. Next. Number 7. Intervention here. Evaluate mental status, noting development of confusion, disorientation. Yeah, rational is reduce perfusion of brain and can produce observable changes in sensorium. Next, number 8. Intervention, note skin color and presence and quality of pulses. Here, intervention. Rational. Number 8. Peripheral circulation is reduced when cardiac output falls. Next, intervention. Number 9. Administer supplemental oxygen as needed. Here, rational is increase oxygen available for myocardial uptake to improve contractility, reduce ischemia. Next, number 10. Intervention, measure cardiac output and other functional parameters as indicated. They are useful. Rational is useful in evaluating response to therapeutic intervention. Number 11. Intervention, administer medication as indicated. Calcium channel blockers, diltiazem, cardizem, nifedipine, procardia. Air intervention, rational, decrease beeping and cardiac workload. Next, beta blockers, atenolol and nadolol. These medications decrease cardiac workload by reducing heart rate and systolic BP. Next, acetyl salicylic acid, other antiplatelet agents, irrational is diminishes platelet aggregation and clot formation. Next, monitor laboratory study partial thromboplastin time or activated partial thromboplastin time. Irrational is evaluate therapy needed and effectiveness. Next, discuss purpose and prepare for stress testing and cardiac catheterization when indicated. Rational is stress testing provide information about the health and strength of the ventricles. Next intervention, prepare for surgical interventions, angioplasty without intracoronary stent placement, valve replacement, coronary artery bypass grafting if indicated. Here, rational is recommended treatment when testing confirms myocardial ischemia. After providing these interventions, we evaluate the patient for achievement of our goals that now dyspnea is disappear and client is active than previous. तो फ्रेंड्स ये था हमारा आज का वीडियो नर्सिंग केयर प्लान on angina and coronary artery disease. This is very important care plan for examination purpose and also the practical file work. तो हमने फ्रेंड्स आपके लिए वीडियो तैयार किया है तो आप इसको ज़रूर ध्यान से देखिएगा लर्न कीजिएगा एंड like this video and your comments send your comments and share this nursing care plan video with your friends and subscribe my YouTube channel Anand Nursing Pioneer. Preparation for nursing competition examination material available and also the various nursing care plan case study material image based questions and so on nursing related items. Then you please subscribe this channel and press bell icon all. Thank you.